The name of the sport may be football, but the knees are every bit as critical as the feet. The quick stopping and starting, the sudden changes in direction simply wouldn't be possible without your knees. Knees are what allow your legs to bend and straighten, to run, jump, and kick. Hi, I'm Dr. Max Gomez, and this is CONCACAF's Winners Health, your football source for keeping players healthy and in the game. Let's talk about one of football's most serious injuries to the knee, the torn anterior cruciate ligament, or as it's usually called, the ACL. ACL tears can be very serious. To understand why, take a look at how the knee works. The knee is a joint. In fact, it's the body's largest joint and one of its most complex. Joints serve as connectors between bones to allow for body movement. The knee, for example, serves primarily as a hinge between the femur or thigh bone and the tibia or shin bone. What moves the hinge are the muscles, like the quadriceps on the front of the thigh that straighten the knee, the hamstrings on the back of the thigh that bend it, and let's not forget the gastrocnemius that brings the calf into play. Okay, so we've got bones and muscles, but we've also got ligaments. Ligaments are thick bands of tissue that connect the bones of a joint. These bands of tissue keep the joint in place. Ligaments are like cables which allow for movement, but only so much movement, because it's the job of ligaments to keep, in this case, the knee joint from popping out.
There are four main ligaments that stabilize the knee. The most important one being the anterior cruciate ligament. This is the ligament that's most commonly torn in athletic events. Injury to this ligament can sometimes take 6 months and up to a year to return back to play.
The ACL connects your shin bone to your thigh bone at the center of the knee, and its function there is critical. It stabilizes the knee when the knee bones rotate in opposite directions and keeps the knee in check as it straightens, preventing hyperextension, where the lower part of the leg extends beyond its intended range of motion. Without the restraining presence of the ACL, the knee might just give way or buckle.
Football has incredible stresses of stop, start, twisting the knee, all of which potentially can tear the anterior cruciate ligament.
And twisting can cause tearing. You've heard of torn ligaments? That's what most ACL injuries are. Typically, ACL injuries occur in football when a player lands awkwardly on a straight or hyperextended knee. It can also happen when a player quickly slows down, followed by a sudden change in direction, or an uncontrolled knee rapidly twists inward, then outward. While tearing can result from a direct blow, 75% of the time it occurs without any contact at all, from twisting or stretching beyond its intended range of motion. The job of the ligament is to hold the knee in place. When a force pulling against it pulls too far, it can tear.
I've had players in my office who've injured their knee who had no idea that they've injured the anterior cruciate ligament.
So how does a player know that it's happened? He may hear a pop or snapping sound at the time of injury, but that doesn't happen in every case.
The one interesting thing about anterior cruciate ligament tears is that the player will feel it initially. They usually present with swelling in the knee, but for the most part, it's painful, but the pain subsides as the swelling goes away. And if they don't have a meniscus tear or other associated injury in combination with the anterior cruciate ligament tear, after a couple of weeks, these patients could be relatively pain-free. And some of them could even go back to playing sports without even knowing. The crucial thing is having these patients evaluated.
Mild tears may heal on their own, but still leave the ligament in a vulnerable state. And tearing your ACL completely will probably mean surgery, which is why players and parents are so concerned about it, especially girls and their parents. There's a lot of information now that suggests that female players are more susceptible than males to ACL injuries. The good news is, and it's very good news, ACL injuries are highly preventable. In fact, with proper training and exercise, ACL tears may be dramatically reduced. In Part 2, we'll show you how you can prevent ACL injuries, cut them by as much as 80% or more. Thanks for joining us for CONCACAF's Winners Health. Take care and stay healthy. For more information about ACL injuries and how to prevent them, please visit CONCACAF.com.